Hi, and welcome to today's segment of Hey Ms Lloyd. In our segments, we hope to share very easy and simple explanations to our students' mental health and interpersonal relationship challenges. I am Ms Lloyd, and I've been working in mental health serving for the past 15 years. I really love working for students and their families. It has been the most rewarding experience, particularly using evidence-based solutions to give enlightenment, as well as to empower our students with proven solutions derived from cognitive behavioral therapy as well as motivational interviewing. Today I'll be answering Mariani's question: how does mental health affect our relationships? Please sit tight and let me pull up the presentation. Again, today's question: how does your mental health affect your relationship with others? Expected outcomes. I'd like for you to gain an understanding of what is meant by mental health challenges. Prefer that word instead of mental disorders, as it gives some hope that things could be done to improve the quality of your life. I'd provide the answer in one word: understanding how mental health challenges impact relationships, as well as our RLRG solution, Robinson Lloyd Resiliency Group, solution to empower students to connect. Let's start with our operational definition of mental disorders, or as I've stated before, we like to say mental health challenges. It's a clinically significant disturbance to cognition, meaning our thoughts, how we're thinking and processing information, emotional regulation. Are we crying for reasons that are okay to cry for? Is the intensity and duration of the crying, what we would probably consider to be just too long, or doing, as my students say, doing too much? Behavior: how are you acting in direct proportion to the situation? It reflects a dysfunction or irregularity in psychological, biological, and developmental processes underlying mental functioning. And this definition was taken from the DSM-5, the Diagnostic and Statistical Manual of Mental Disorders. Do mental health challenges affect relationships? Right, and that should be, does mental health challenges affect relationships? The answer is yes. Now, show you how. We first have to understand which relationships are affected, right? So for adults, we're looking at the stress in social relationships, as well as for students or school aged children. We're also looking at the occupational relationships and important activities, right? Extracurricular activities, or just volunteer activities, where we're not satisfied with the quality of our interactions. We're possibly always feeling that someone is out to get us, they're trying to sabotage us in some way, they're trying to prevent us from doing what we have to do. In some cases, this may be very well be the case, but how do we respond to these perceived threats? And the DSM-5, or the group of professionals and doctors and psychiatrists that have developed the DSM-5, they recognize an importance of asking, is it a culturally approved response to events in life? Culturally approved, right? So we all come from different cultures. You may hear my accent and know straight away the sing song that it's Trinidad, right? I'm from Trinidad and Tobago, the beautiful Twin Island state, right? So we may have certain ways that Trinidadians would respond, sorry, to events that Americans or Canadians or St. Lucians may respond in different ways. Does that mean that something is dysfunctional based on our response? No. If it is culturally appropriate, then it's fine. We have to understand how our cultures are approving or disapproving of certain behaviors. Now, when we think about mental health and the effect it has on our relationships, we start, of course, with our thoughts, right? And how we look at a situation, any given situation. I like to use a very common situation about, children or students reporting that a fake friend blocked them from all of their social media platforms. Now, if we were to think about that happening to us, of course it hurts, right? What did that person do that for? And then if we start going down this sort of negative cycle, people always leave me. I don't care. I hate fake friends. If we go down that loophole, it's just going to take us further and further and further into unhappiness and depression and wanting to withdraw and perhaps even wanting to retaliate. Basically, as human beings, we carry all of our memories. A lot of our memories are stored, and we carry them with us. And so when a negative event occurs, what typically happens is that we associate that negative event with a prior negative event. And our minds are everything about us is just so awesome. We were created to adapt and evolve, and part of that adaptation and evolution has come from our ability to identify threats and to know how to respond to those perceived threats. And if in your past, you've had experiences where typically, Freud, he would say that, whatever we find or we perceive to be traumatic, it stems from our childhood and our relationship with the adults in our childhood. Did these adults provide security, or were they moody and, in and out of our lives, and we just couldn't predict what they were going to do next? This has an impact on how we relate to the rest of the world, particularly when these experiences have been forgotten in some cases, or the impact, the emotionally significant impact, has been denied or covered up by our egos. They've been pushed to an unconscious state where we're reacting to things and we're not quite sure why, right? And so let's move from the thinking about the situation to the connection that it has to how we feel, right? And if I'm going to pull up a lot of negative thoughts and tap into unconscious emotions that are, already sense neurons, it's already connected, and it's really triggering me. So that word trigger, right, it's causing me to feel things like anger, sadness, abandonment, hurt, right? And those feelings are directly related to my actions, right? If I'm feeling angry, sad, abandoned, and hurt, what am I likely to do? Right? I may be reactionary and I may block the person too, right? Because I'm hurt as well, right? But what if the same situation, Michelle blocked me on all social media, but what if I decided to just pause for a second and say, okay, Michelle and I have been friends for about 2 years. We've had, an on and off relationship, but she's really nice and she's been there for me. And I know that when she gets in trouble, her mom takes the devices. She has to come off of social media, and it may happen suddenly. What if instead of immediately reacting and thinking the worst possible outcome, what if I stopped myself and I said to myself, well, what are some other possibilities that are more positive and realistic in nature, right? And then that way, if my thinking is to think the best of Michelle, right, instead of the worst, then I would be able to even have empathy or concern about if Michelle is okay because I'm used to hearing from her and she hasn't responded. And if I know that I've searched my conscience and I really didn't do anything to her, then maybe something's going on her end, right? And so you see how the different ways of thinking, right? Someone who is mentally healthy, they're thinking, they're able to think through not just a right or if something is right or wrong, they could see also the shades of gray and they could act in a way that brings about harmony, right? And connection. Okay, and that's the impact of our mental health on our relationships. Without respect, love is lost. Without caring, love is boring. Without honesty, love is unhappy. Without trust, love is unstable. And that was a quote from the Buddha, right? What's the point of relationships? What's the point? Is it to use people to get what we want, to take and not have to give that much back, to hurt those who hurt us? Is that the point of relationships? I would hope not, right? The point of relationships, in my humble opinion, is for connection, authentic connections, for love, for empathy, and the whole idea, the beauty of social emotional learning really is for us to not just be aware of our own feelings, but to recognize and feel what someone else is feeling in the moment, to be able to respond with a deep sense of humility and understanding and a desire to connect. And sometimes that desire takes some vulnerability or willingness to, you know, perhaps be rejected, perhaps get hurt, but it would be worth it. How can relationships happen when our ability to trust or believe the best about others is fractured? And what causes the fracture? Of course, as I've shared, the Freudian belief is the parental relationships, and experiences in our lives, the relationships of between ourselves and those who were put to take care of us, whether it's our natural parents, adopted parents, or caregivers, right? Were they able to really connect with us, to be available to us, to build secure relationships with us? Now, of course, even if we've had unhealthy relationships with our parents, that's not the end of it. It's not, oh no, I'm doomed because, you know, my this parent did this and that parent did that, so I'm just doomed. So that's not the case, right? Of course, there's our tremendous ability as not just human but spiritual beings to heal, to evolve, to be vulnerable, to feel light, to gain a sense of purpose and fidelity and loyalty to our core, which is so good and so pure, as Dr. Brody, who is a relationship therapist and coach, read her book, Stop the Fight. It is very powerful. It helps you to, her book clearly illustrates the power that we all have within us at our core to just be good and be loving and be vulnerable. All right. And so we get to, the Robinson Lloyd Resiliency Group RLRG solution, right? And first, for us, it's a simple three-step process. We identify how to help using the Resilient Stars profile that looks at grit, self-esteem, anxiety, and depression. We then customize the Resilient Stars or Resilient Warriors program to our students or to our private clients. And at the end of the program or the coaching session, we then evaluate the efficacy of our program, right? How well did our clients, students improve with their grit, their self-esteem, their anxiety, and their depression? And we really want to we want our interventions are meant to be an answer to uh, childhood mental health challenges such as anxiety and depression that start manifesting from early on, but sometimes we don't we unfortunately may respond only in a crisis and not recognizing that children could be quietly hiding their anxiety or depression and struggling in interpersonal relationships. They may not be struggling academically, but they're struggling nevertheless. And we want our students to be empowered, right? We want them to gain these tools at a young age, to practice them in a safe space, and then to see how awesome life is by observing the connections that they're able to make with their parents, their teachers, their friends. Okay, now let's get to an example of how this works in real time, right? And we have one of the pillars of resilience. The five pillars that we base our program on is called letting go mentally, right? We're reframing our negative assumptions. Okay, so part of it, of course, we always work on increasing our self awareness. What am I thinking? How is it making me feel? How do my thoughts, do my thoughts make me do? What do my thoughts make me do? Right? And once we sort of we're able, it's very mindful in nature. We're imagining we're able to just slow things down and point our thoughts out and observe them. Michelle blocked me on social media. Instead of getting really negative, I could just pause and say, okay, that hurts. I thought we were closer than that. It hurts that she blocked me, right? And then I could just observe what I'm thinking without reacting. Ask yourself if your thoughts are 100% true. What if it's not 100% true? Okay, yeah, she blocked me. That's true. But what if I'm wrong about the reasons behind it, right? What if before I start getting into, nobody likes me, friends are fake, I'm all alone, right? That could never be 100% true because I'm never always alone, right? You're never always alone. We're always just seconds away from texting someone or calling someone or even saying hi to someone else and making a new friend, right? When you think I'm all alone, do you then withdraw into yourself or make yourself a bother by just, hey, everybody, here I am, it's me, hee hee hee, right? Do you make yourself a bother like that? Or which in turn it sort of turns into this vicious cycle of a self-fulfilling prophecy because who wants to be around you if you're being annoying, right? And you can't even recognize that you're being annoying. And And if you withdraw, well, you're going to be alone, right? So, sort of recognizing the connection between the thoughts and feelings and actions, and realizing that we are capable of breaking that cycle. All right, so we want to reframe. Here's how we do some cycle breaking. We want to reframe the I'm all alone. I feel lonely, right? I'm all alone. Let me pause and say, okay, tapping into the feeling, right? I feel lonely today. I miss my friend Michelle. Hmm. Let me reach out, right? I know her mom's number. I could say hi, Miss So and so. I miss Michelle. I think we had a bit of connection issue, and I would love to be able to talk to her and see how she's doing, or to learn if there's anything that I could do to be of support. And mom would say, okay, let me let her know and get back to you. And if she gets back to you, great. You've taken the first step. But if she does not get back to you, guess what? That's okay too, right? You simply decide, all right, I have to be more aware. I'm not sure what I did to Michelle, but in time it may be revealed. Other than that, I could get closure within myself to say, here's how I'm going to look at myself and find the values within myself that I love and I could build upon, and the values that I love in other people that I could attract to myself, or I could look for, actively look for in others. Right? So I don't have to look for who's fake or who's this or who's that. I could look for people who are kind, and they love people, and they're caring, and they're genuine, and they want to have genuine connections as well. All right. I think we have just about a couple more slides. The Q&A. Please feel free to leave your comments, your questions in the link below. As I shared earlier, we want to provide our students, our clients, with simple, easy, relatable, evidence-based responses to their questions about mental health and interpersonal relationships. I hope that you've gained an understanding of what is meant by mental health challenge. I hope that you agree with me that yes, mental health affects our relationships. I hope that you understand how mental health challenges impact relationships. Our RLRG solution to empower students to connect, right? We would like students to be uh, better versions of themselves at home, in school, and in the world. That's our vision. Please subscribe to our channel, ask questions below, and email Lloyd at rlrgresilientstars.com if you'd like to know more about booking our services. All right, that's it for today's segment of Hey Ms Lloyd. Thank you so much, Marianise, for contributing your question. How does mental health affect our relationships? I hope that you found the answer to be comprehensive and easy and simple. Thank you so much, and I look forward to talking to you again next week.